We find Vecna, we end this once and for all, together.
On November 26th.
We have a plan. It's a bit insane. Everyone in?
He knows where we are.
Watch out! Get ready for one last adventure.
We stay true to ourselves. Stay true to our friends, no matter the cost.
Found you. Stranger Things, the final season, begins November 26th, only on Netflix.
With new, gentler scented Clorox disinfecting wipes, clean finally smells as good as it feels. On everything from lamps to ceiling fans. Even on your kid's toy shark. Oh, ouch. Clorox disinfecting wipes, now available in crisp lemon. Find it on Amazon. Clorox, clean feels good.
Meet the computer you can talk to. With Copilot on Windows, working, creating, and collaborating is as easy as talking. Got writer's block? Share your screen with Copilot Vision to help spark inspiration, and use Copilot Voice to have a conversation and brainstorm ideas. Or maybe you need some tech help. With Copilot Vision, Copilot sees what you see. Let Copilot talk you through step-by-step guidance so you can master new apps, games, and skills faster. Try now at windows.com/Copilot.
You see? You see? Your stupid minds. Stupid! Stupid!
Well, that's because you're an idiot.
You get nothing. You lose. Good day, sir.
Man, you are one pathetic loser.
Dr. Steve, I hope you're better at prostate screenings than you are at radio screenings, you son of a bitch.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Bez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve,
take a cowboy, do the vertebrae.
From the world-famous Cardiff Electric Network studios in beautiful downtown OJ City, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider, gives me street cred, the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
This is a show for people who had never listened to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's DIP.
Poohead? I was just like, dipshit?
Dip Poohead.
Okay.
The only word I could come up with for 347 was dip. It's stupid. Follow us on on Twitter at Weird Medicine. But if you're ever forgetting the prefix, you can remember Poohead, but you can't because people say 866 Poohead.
Oh, gotcha.
So now you can figure it out. It's dip. Little Twix cheek and gum.
Gotcha.
Follow us on Twitter at Weird Medicine and Dr. Scott WM. Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Most importantly, we're not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. Don't forget to pick up your copies of DABBLEDICE, which is fun for dabblers of all ages, as long as they're 18 or older. And always drink responsibly, unlike certain people. So this is, you don't have to have any dabbleverse lore. As a matter of fact, it has absolutely nothing to do with the dabbleverse, except it says DABBLEDICE, because the name of our company is Dabble Games. And it's a party game. and it's loads of fun, and I'm selling it at cost because I don't want to make any money off of it. So it's $350. Go to stuff.drsteve.com, and you can click the link there, and it will take you straight to our store. We have a new game coming out probably after the first of the year. Pig Knuckle Pinochle there, Dr. Scott.
Oh, my gosh.
We'll have all your favorite characters in there, old Myrtle and Gladys and Delmer. Delmer will be there too, and Norman.
Love it.
Yep, they're all there in Pig Knuckle Pinochle, a game of, I don't know what it is, a game of tricks and trumps or something like that.
Did you invent?
And not that trump.
Did you invent this?
Yes.
Did you?
Yeah.
My grandpa used to make us play Pinochle when we were kids.
Yeah, it's a horrible game.
Terrible game.
You have to bid
Yeah.
and all this, it's like poor man's bridge. Well, this one, there won't be any of this bidding bullshit.
Oh, thank
You just
goodness.
flip the card over, and that's what the trump card is, or the trump suit. And then it's not going to be diamonds and stuff. It'll be hogs and, I don't know, corn mash.
There you go.
There you go. I haven't figured that part out yet. So I'm working with Troy Smith on some cards and doing some things. So we'll see. It's going to be completely unrelated to all this stuff. And by the way, DabbleDice is a completely fictional game. What's the wording, Dr. Scott? Any resemblance to persons living or dead is completely coincidental. And if you see yourself in this, that talk says more about you than it does anybody else. All right?
It's wishful thinking.
Yeah, well, or whatever. Okie doke. Check out Dr. Scott's website at simplyherbals.net. They're on a little bit of a hiatus right now, but we want them to come back because that CBD nasal spray, I can't live without it, to be honest with you.
Stuff.
It is good stuff. So you're coming back, right? Why are you thinking about it? What's the deal? Are you not making any money off of it? You keep selling out.
Yeah.
You're not selling for less than you paid for it, right?
No.
Because that would be stupid.
Yeah.
No.
No,
stupid, shopkeeper says, "Oh, I sell everything under cost." And you go, "Well, how do you make any money?" And he goes, "Volume."
Volume, yeah.
Makes no sense.
Makes no sense. No, I think that it's just effort.
Yeah.
Just effort. Having people get things done for you.
Well, that is a problem.
I'm easing into the sunset of my career, I believe.
Well, just sell it to somebody then.
Well, I would.
How much you want for it? For the whole business, lock, stock, and barrel, because it's really just a website storefront and some proprietary
intellectual property.
IP. Yes,
yeah, that's all. It is.
So, what do you want for it?
I'll come up with a number.
Well, we got somebody listening might, Anyway, all right.
$1 and then 10% for
that might be something.
Forever.
That might be something. We'll talk.
10% forever.
Check us out on Patreon. Patreon's still quite active, posting classic shows there that you can't get anywhere else, plus other content you can't get anywhere else. They were getting all the normal world stuff first, but I'm going to just dump everything on there that I've got, and it's also going to go on our YouTube channel eventually too. And then if you want me to say fluid to your mama, cameo.com/weirdmedicine. By the way, DabbleDice is fitted just perfectly. I put it in 4 different stockings today, and it fit perfectly. So I'm sure my children and my daughter-in-law will be thrilled.
Oh my gosh!
When they get their copy of
excitement,
DabbleDice, the game of beer disequilibrium and cirrhosis. All right. Yep. If you get cirrhosis before you collect your 13 beers, you lose all your beers.
Rats.
That's right. Just for that round.
Bad way to go. Just for that round. Okay, good.
All right. I have a statement. On my final SiriusXM show, I said F you to Tim Sabean. And it was kind of a joke. I was thanking all these people that had helped us over the years. And I said, but, least and certainly not in any way saying thank you to Tim Sabean, who tried to have this show taken off SiriusXM because, and what I was told was that he was irritated with me because when I met him in New York when I went to do an Opie and Anthony appearance, he said, "Oh yeah, I started that Harry Fish medical show over on Howard Stern's channel." And I was like, "Yeah, that shit's really boring, Tim." Mm-hmm. And at the time, we were a little wilder than we were. But the problem with Harry Fish was he didn't think scientifically. He had a porn star who squirted in his office, which was pretty cool. Mm-hmm. And then he tested it for urea and said, "See, it's just piss." And it's like, you can't do that. You have to also test it for prostatic-specific antigen, because if you do that, then it can't be just piss, right? So that was the first thing. He had there was an anti-scientific bias because he had a bias that it's just urine, so that's all he tested for. All his tests could show him was that it was urine. Mm-hmm. Couldn't show anything else. Right. So that, and also he was a urologist, so he didn't know shit from Chinola about all this other stuff that we do because we're generalists, and so he couldn't answer a lot of just sort of basic medical questions. Then it devolved into life, love link type questions. And the last person I'm taking love advice from is Shuley and not Tim Sabean and Harry Fish. Let me say that again for the Clippers. The last people I would take love advice from would be Shuley and Harry Fish. So there you go.
There you go.
So I just was like, "Oh, really? Oh, that was your show?" Or, congratulations. And he took it in good stride, but then I was told afterward that it pissed him off, and he tried to have me removed from the channel with the excuse of saying, "We just want only Opie and Anthony content." But one of the hosts went to bat for this show with the administration over there, the offices upstairs. That'd be Steve Blatter and a couple of other people, and saved our show. So I've been thankful for that for a long time, and pissed off at Tim Sabean. Well, I have started hearing from people like Eric Nagel that the same scenario had played out multiple times in that environment where somebody would say, your job's in danger, but I saved it for you. And they would be very thankful. And so I called Tim Sabean. I said, "Did this really happen?" He was like, "Hell no. No, it never happened. Your show was perfect for that channel, and I always supported you on there." Now, he could be blowing smoke up my ass now, but we talked for about 90 minutes.
Oh, wow.
And I really enjoyed my conversation with him, and I believe him that it never happened. So I'm going to say I'm very sorry that I've been motherfucking poor old Tim Sabean for how long has it been since all of that happened? God, they were still on the air, so it was probably up in MFing him for 10 years.
Oh, geez.
And of course, I wasn't on his radar, so he never heard about it. But he took my call. And we talked for 90 minutes, and we're cool, and I will never MF him again because I believe that it didn't happen.
Cool.
Isn't that something?
Good old Tim.
So that's that sort of corporate politics kind of thing that happens. And you got to go to the horse's mouth on these things, y'all. So the reason I'm telling you this, first off, I owe Tim an apology publicly. But I'm telling you this because this stuff happens all the time in corporate America and corporate probably everywhere else. And when you hear someone said something about you or someone was going to do something, go straight to them. That's the only decent way to live. The problem was I wasn't there, so I didn't really have a connection with him. I only met him once. If I
just
knew
long enough to piss him off.
What I knew now, right? What I knew now, I would have emailed him or gone to him and say, "Hey, is this true?" and let him clear it up. So anyway, and don't fall for intra-office gossip either. Okay? All right. Thanks, everybody. Thank you, and thank you, Tim. And hopefully we will work together again someday. Anyway, it was funny when I said it on stage. It just wasn't true, and it wasn't fair to him to shit on him like that. All right? You got anything?
Yeah, we did have a good question from Shroom.
Shroom.
My dad is fighting colon polyps for years.
Yeah.
Soon to have his second surgery.
Okay.
What can we do to prevent that?
Well, okay. So the question is, does he have familial colonic polyposis?
Yeah.
Because this is a genetic thing.
Right.
And the polyps themselves aren't the problem. It's when they're left alone and they turn into cancer that they become the problem. So I have a friend who has familial polyposis and his colon's full of polyps, and they go in every year and do a colonoscopy looking for cancer. And he is at risk of getting colon cancer, but he's at decreased risk of dying from it because he knows about it and he gets his colonoscopy done every year. Same thing with your dad. Now, aspirin, and I'm not saying he should take aspirin, but salicylic acid is known to decrease the risk for colon cancer. So, but it increases risk for gastrointestinal bleeding too, and other kinds of bleeding. So he would have to talk to his primary or to his. He has a gastroenterologist because he's getting colonoscopies for it. They got to talk to them about it. But the good news is, yes, Dad is at increased risk of getting colon cancer, but he is at decreased risk of dying from it because he's aware of it and he's getting the preventative treatment that he needs, which is colonoscopy. If you catch colon cancer in the polyp stage, a lot of times you can remove the polyp right then and there, and that's the end of it. If you catch it, but if you don't, and you catch it in stage 1 or stage 2, it's curable.
Yeah,
absolutely curable disease. Just catch it early.
And then there's lifestyle.
Okay.
Things he can do, yeah.
Well,
too.
Increased fiber and decreased inflammation in the gut.
Other things.
Go ahead.
If it's not a familial deal, it's more of a lifestyle thing. The smoking. If he smokes, smoking cessation.
Well, always quit smoking.
Yes.
We say that about everybody. don't
true.
don't smoke.
Just don't. That's one of the things you can't do.
You got some fat cat at RJR going, we got him to buy another pack.
But it's the same thing with all other lifestyles, exercising and healthy weight.
Yeah.
Hydrations, but lots of fibers and things of that nature can help.
Yeah.
To reduce the incidence of polyps.
Yeah.
But if they're there, surgically removing them is a pretty good idea.
This episode is brought to you by McAfee.
Swimsuit, passport, phone, with VPN activated.
VPN?
Cell phone service is going to be spotty on vacation, so we'll be using public Wi-Fi.
Sounds sketchy.
Exactly. The networks can leave your personal info, like credit card numbers, exposed to hackers.
McAfee's secure VPN lets you browse and bank safely from wherever, whenever. Learn more at McAfee.com/online protection.
Kraft mac and cheese is the best thing ever. It's even better than pop music. You look just as natural enjoying us at age 13 as you do 55. Kraft mac and cheese. Best thing ever.
This episode is brought to you by Greenlight. Get this. Adults with financial literacy skills have 82% more wealth than those who don't. From swimming lessons to piano classes, us parents invest in so many things to enrich our kids' lives. But are we investing in their future financial success? With Greenlight, you can teach your kids financial literacy skills like earning, saving, and investing. And this investment costs less than that after-school treat. Start prioritizing their financial education and future today with a risk-free trial at greenlight.com/Spotify. Greenlight.com/Spotify.
The Lincoln Wishlist sales event is happening now. Here's what's on everyone's wish list. Enjoying holiday jingles with brilliant 3D audio that surrounds you? Check. Watching snow flurries through the panoramic vista roof? Check. Packing up presents with the spacious Lincoln Splitgate? Check. Everything you want. All standard on the 2025 Lincoln Navigator SUV. Visit your local Lincoln retailer or learn more at Lincoln.com for exceptional offers on 2025 Lincoln vehicles today.
Hi, I'm here to pick up my son Milo. There's no Milo here. Who picked up my son from school?
Streaming only on Peacock.
I'm gonna need the name of everyone that could have a connection.
You don't understand. It was just the 5 of us. So this was all planned.
What are you gonna do?
I will do whatever it takes to get my son back.
I honestly didn't see this coming. These nice people killing each other.
All Her Fault, a new series streaming now, only on Peacock.
Look at this. McRibs is a ham radio operator. Did we know that? Well, they're doing a fox hunt. Okay, so...
Oh, no.
So what a fox hunt is somebody goes and hides and they start transmitting, or they'll place a transmitter that will broadcast for 30 seconds every 2 minutes or something like that. And then you get people out there with directional antennas trying to find it. And it's good practice. Okay. And he said we had a fox hunt at a local wooded park. You can imagine how I was trying to find the fox by sound because my one eye is loaded with fluid. Not too well. Yeah, he had a vitreous hemorrhage, didn't he?
Mm-hmm. Yes.
Is that what it was?
Yeah.
What are they doing about it? McRibs, it should be taken care of. It says my vitreous hemorrhage is still around, and I'm told I needed cataract out before they took the blood out. Okay. I know why. Because they can't see through your cataract. They want to be able to see what the hell they're doing. Mm-hmm. Well, now it's out. I'm feeling like forever to get the hemorrhage out. Super depressed. I'm sorry, buddy. What can I do? You can call them on the phone and say, listen, put me on the wait list. Mm-hmm. So what's probably happened is they've got all these people stacked up to have surgery, and they don't want to rush you. But just call them and say, if you have a cancellation, I want you to call me. Mm-hmm. Just do that. That's what you can do.
Yep.
And your depression right now is reactive, sounds like.
Sure.
Sorry. And you can talk to your primary about, if you need treatment for it. But it sounds like you're depressed because you can only see out of one eye, and they need to fix that.
Yeah.
So call them Monday.
Yeah.
Say, is there any updates on this, and can I get on the waiting list?
Right on.
Okay. Yeah. All right. Anything else?
I did find a great one from our wonderful Kentucky.
James Weston says, I got a huge crack in my butt. What do? You shit out of a hit. That's what you do.
All right. Our favorite Kentucky hick, Amy, does have a good question.
Okay.
Why do urinary tract infections make dementia patients even more batshit crazy?
Now say that again.
Why do urinary tract infections make dementia patients even crazy?
That's a great one. Do you want to take some of it? It looks like you've got something to say about it. I see this every day. So.
No, I was going to. No.
Oh, okay.
No, go ahead. Yeah, I had
it's the inflammation.
Yeah, okay.
The brain is one of the most sensitive organs in the body to changes in the body. So, for example, if I punch you in the kidney, it might bleed, but it'll still work. If I punch you in the head, I'm going to knock you out. Sure. The brain's still functioning, but the conscious part shuts off. And when you have someone with a little bit of dementia and they get inflammation, doesn't have to be urinary tract, could be pneumonia.
Okay.
Could be a urinary tract infection, could be, I don't know, skin infection like cellulitis, or they break a hip. And the inflammation from the body trying to repair that will send their dementia into outer space. So there's 7 stages of dementia, with 7 being divided into A, B, C, D, and F. But so like 7C is someone that can't walk and can't talk.
Okay,
they're just kind of laying in bed, curled up, making noises all day. Stage 1 is sort of like my professor I've talked about that couldn't remember what a deck of cards were, but described it as a concentric stack of thin laminates. Okay, so they're kind of eccentric. They're losing some of their executive functioning, but they can still do things. And so that's the extreme. So it goes through 7 levels, and people with Alzheimer's tend to march through those levels pretty steadily. People with vascular dementia will march through stepwise. They'll be okay for a while, then they'll
just drop.
Then they'll just drop.
Wow,
and then they'll be there for a while and they'll drop. So that's because they're having mini strokes, and each mini stroke drops them a level or 2. So someone that's a stage 1 or 2 can come in with a urinary tract infection. All of a sudden, they're all the way in stage 6 where they're just,
it's inflammation.
Just out of their minds.
Okay,
right.
Okay, that makes sense.
Yeah. No, there's some factor that's released that causes the brain to misfire. And the older you get, the more likely it is. I remember I had a friend whose mother just started acting, wild and paranoid, and thinking there were people outside, and that she would call the police because there were people in her backyard, and they had to finally put her number on a special flag that this person call this other person to make sure that this is really real and all that stuff, because sometimes there might actually be somebody in your backyard. Well, anyway, one of the cops told him, get your mom checked for a urinary tract infection. That's, in fact, exactly what was going on, because they see it all the time.
All the time. Well, no, and I think my confusion was I wasn't thinking UTI, I was thinking cirrhosis. I was thinking ammonia building up in the...
Oh, yeah. Nope. Yeah. All right.
Not even close.
The bags on you says, I'm having general itchiness. I'm assuming it's because I'm developing liver disease from my drinking. My pancreas seems to be failing because my stool looks pale and loose. I'm 31. Am I going to die? Bro, we're all going to die. Okay. So that's not the question. The question is, do you have something that's reversible? And when you have clay-colored pale stool, it generally means that you're not secreting bilirubin into your bowel from the gallbladder, and that comes from the liver. So, yeah, there may be something going on with your liver. That is a reason to go get seen immediately.
Yep.
Do you need to go today? I would, but it sounds like it's been going on for a while, so Monday is good enough. Call and get it taken care of. The itchiness could be general, what we call pruritus, because we have to have a different word for everything, but it's means itchiness.
Sure.
And it comes from bilirubin that's gotten into the blood, stimulating mu-opioid receptors in the skin. And every once in a while, we'll put people, particularly if they're drinking, we'll put them on naltrexone.
Right.
It helps prevent the drinking, and it also stops the itching from the bilirubin. And the liver, I'm going to tell you, the bag's on you. I don't know you, but I want to hear from you again. The liver is one of the most regenerative organs that there are. If you damage your heart, there will be a scar tissue there, and that's the end of it. If I take out 2/3 of your liver and leave you 1/3 of a liver, it will very often grow back, or it will at least resume the full function of the liver over time. So if you stop now and get on treatment, you may be able to turn this thing around. So, please do that. Okay.
Mm-hmm.
It's not, the alcohol is not doing you any good. It's your enemy. So, at this point, go to a meeting, go right now. That you can do. They have meetings 7 days a week.
Mm-hmm.
But then get this you can't do but this by yourself. You're going to need medical help. But talk to them about the naltrexone. It really does help people stop drinking, and it will absolutely put a stop to that itching if that's what it is. Okay?
Yep.
Got any other questions out there?
I was looking back through.
Well, Kai Brancaccio says low-dose naltrexone has been used in pain as well as stroke patients. Yep, that's right. I use low-dose naltrexone every day. If you have someone that's not on, so naltrexone, let's talk about that. It is previously used as a medication that will block opioids at the level of the receptor. So if you had somebody who was overdosing, you could give them naloxone IV, which is an analog of naltrexone, and it will wake them up because it competitively interacts with those receptors and knocks the narcotic off of there. But it doesn't have the respiratory or sedative effects, but it has more affinity for the receptor, so it'll just knock the opioid off, and then you excrete it out of the urine. So this low-dose naltrexone, we use it for pain, which sounds weird because we were using naltrexone to block opioids, and now they're using it for alcohol abuse. Why? Because there are opioid receptors in the brain, pain and pleasure receptors, that are being fed by endorphins that are released when you drink alcohol. And that's what gives it that pleasurable effect. And so that will stop that sort of craving for that form of pleasure by taking the naltrexone. At least that's the hypothesis behind it. Low-dose naltrexone we'll use for pain because what it seems to do is it blocks endorphins, which are, narcotics that your body makes, temporarily. And then when the naltrexone washes out, those endorphins that have built up in your system will then hit the receptors. And it's really good for things like fibromyalgia. People who've tried everything for fibromyalgia do great on low-dose naltrexone. Mm-hmm. And, and he's right that he or she is right. They use it for, stroke patients as well. And I'm not sure what the hypothesis is there on how that's benefit. But anyway. All right. Okay. Crispy Biscuit says naltrexone worked very well for helping me quit drinking. Barely any side effects. Yes, there should be no side effects whatsoever. Although if you try to take a Percocet while you're on that, it's not going to do very much for you. All right. It says Crispy Biscuit says I was developing fatty liver at 33. My cholesterol and AST and ALT, those are liver enzymes, were way elevated. They're all normal now at 35. Now, Luke says naltrexone is in buprenorphine. So yes and no, it's in Suboxone. So Suboxone is buprenorphine and is it naloxone? Suboxone, let me see.
I think it is naloxone.
I thought it was naloxone. Yeah, naloxone. So it's an analog of naltrexone. But the reason that they put that in there is, okay, so buprenorphine is used for pain, but it's also used for opioid use disorder. And what you do is you get the patient to come in just in the beginning of withdrawal, and you give them their first Suboxone. And this is buprenorphine and naloxone. Comes in a little film thing that dissolves on their tongue. And all of a sudden they feel better. So now they see the value in it. Mm-hmm. And it's very hard to overdose on this medication. Don't try. I'm just saying, it's got a good safety profile. And it does have some competitive effects with other opioids. In other words, when it's in your system, you may have to take more standard, what we call full agonist opioids to get anything. Okay. So it's a good drug for medication-assisted treatment for opioid use disorder. They put naloxone in it in the Suboxone because if someone were to put this in alcohol and, take out all the buprenorphine, from the film and try to shoot it up, then it won't work.
Gotcha.
Because then the naloxone will kick in. Because when you take naloxone orally, unlike naltrexone, it is not absorbed orally. It just goes straight through the GI tract. But if you try to shoot it up, then it won't work. Wow. Same thing with Talwin NX. Talwin had pentazocine, which was an opioid, and it had naltrexone in it. No, it was naloxone. Mm-hmm. Naloxone in it. And that was another one where if they tried to crush it and put it in water and shoot it up, then the naloxone would kick in and it wouldn't work.
Gotcha.
It was abuse. It was a way to
increase
abuse deterrence. Yep. Exactly.
Yep.
Okay?
Wow.
All right. So, Luke, excellent question.
Great question.
And yes. Luke also says, well done, Crispy. Absolutely. Well done.
Yes.
Let's give him one of these. Let's see. There you go. All right. Oedipusaurus Rex 901 says, I've been on Suboxone for 3 years. I'm down to one a day and hopefully be fully off soon. Yes, thank you for that. Some people get on Suboxone and they stay on it forever. Mm-hmm. There are other people who say you get people on the Suboxone and then you keep them there for a while, let them get out of the habit of going downtown to cop and all that stuff, and then wean them off. I like that approach. I think total sobriety is the key, but there are addictionologists out there that just say, look, there are some people.
The recidivism is too high.
Yeah. So.
Yep. Agreed.
All right. So king of the diffs. Wait, what? And why is he king of the diffs now? Didn't he used to be king of all diffs? Oh, no. Am I having a senior moment again? What's the best thing to take to stop drinking? Well, the best thing first is you got to commit to stopping drinking, because you can't just go, well, I want to stop drinking, I'm going to take a pill.
Yeah.
So, and define best thing. For some people, the best thing is just to go to a meeting and just stop drinking that way. So the best thing to do is go to an addictionologist, work out what's going to work best for you, because everything's different.
So, and I was going to say, and one of the great things about the meetings is you get support and people. But the other thing is it changes your daily habits too.
Yeah,
because you know as well as I do, a lot of this stuff is habitual.
Yep.
As soon as you take someone out of this, and it's the same thing going back to the opiates.
Yep.
And you take someone out of that daily habit, and I don't care what it is. I don't care if it's a work addiction or a sex addiction or a drug addiction or alcohol, but changing that daily habit will make them change or help them change the addiction. And the Oedipus Rex had another question about a papillary thyroid cancer.
Okay.
That was removed and is now having trouble with calcium absorption.
Oh.
And is taking calcitrol. Just wondering if there were any other thoughts for calcium.
They probably took out one of their parathyroid glands at the same time.
Yep. One would assume. I'm sure
post-surgical hypocalcemia is a big thing with this because of the damage to the parathyroid glands. So the parathyroid glands are in charge of that.
Yep.
Without going into too much detail.
Yeah, a lot of green leafy vegetables do have calcium, and depending on, because you hear dairy products. Certainly, you can take calcium supplements, but sometimes they're hard to absorb.
Yeah.
Vitamin D can help kind of with your absorption, but
they usually have people take calcium and vitamin D together,
correct,
because it improves these things. And if your calcium just remains low, there are things that you can do. Just see your oncologist about it.
Yep.
Because they can do them in the infusion center if they have to. But if you have low calcium, you're going to have fatigue and some really severe health issues if things get really low. So you don't want to get that let that get out of control. All right.
Mm-hmm.
Well. All right. Anything else?
I think I get to most of them.
Okay. Well, McRib says meetings in my area are always people who start off with, I want to cop with my kids in the car, or something that has to do with CPS. What? It's never about casual users, and of course, no cross time. What is he talking about? I don't know what he's talking about. Anyway. Yeah, okay. Oedipus, if it's working for you, great. If you know what you need at the time, don't beat yourself up. Right. Don't beat yourself up. It's this is a disease. It's an illness. It affects behavior. So we look at it a little bit differently than we do things like cancer. But I just want you to get the help that you need. And you're not going to be judged by whatever addictionologist you go to. That's the whole thing that they deal with.
Yeah.
And Don Jr. says withdrawing from opiates is hell on earth. Absolutely. Absolutely, it is. So you don't have to do that. You can get help.
Mm-hmm. Mm-hmm.
If you go through full-blown withdrawal, you're at risk for a thing called post-acute withdrawal syndrome that can last 2 years, can cause anxiety, depression, flashbacks, all kinds of malaise, muscle pain. So we counsel people don't do that. You can go do it through medication-assisted treatment. And, I got into a discussion. It was actually an argument with somebody at one of these CBD places that sell kratom. And they're like, well, Suboxone, they just get them addicted to it. And it's like, okay, they're already addicted to opioids. This way they're not copying, they're getting it in a clinical situation, and then we can wean them off of it. Kratom is similarly addictive. It affects the mu-opioid receptor. I've had patients, and we've had listeners to this show, that used kratom to get off of their opioid, and then they got addicted to the kratom because they still were having that mu-opioid receptor stimulated. So there are downsides to everything. I'm not saying anything about kratom for the kratom lovers out there, other than it is a medication that has real pharmacologic effects, and it does affect the mu-opioid receptor on top of other things. Having said that, I think it's a fascinating molecule that needs to be further studied. We have a lot of things to learn about kratom, and we've got a lot of things to learn from kratom.
Yep.
Because it may be the thing.
Might be good.
But, we need to be studying psilocybin for medication-assisted treatment and other things like that, too. All right? Anything else from the fluid family?
No, I don't think so.
Okay. All right. Well, I see lots of things on there. You feel free to throw in on any of those. Here we go. Let's. We were talking about fatty liver. Here's a question about fatty liver.
Quick question. I need some help.
Yeah.
Not long ago, I had some pre-admission testing. I'm getting a shoulder replacement done here next week. My liver enzymes are elevated. I think it's because of the Percocet that I'm taking. I don't know. I think it's because of diet. So I've been hardcore keto for the last 2 years. In March, my wife passed away.
Oh, I'm sorry.
And since then, with the in-law drama, I haven't been able to stick to keto. So do you think it's the extra sugar that I'm eating that is causing fatty?
It could be that, and I'm sorry to hear about your wife, man. Fatty liver can be genetic, but it can definitely be from diet, and the carbohydrates are a big part of that. More so than fat, which is weird. You would think fat would cause fatty liver, but no, it's processing of carbohydrates that tends to cause this. But if you're taking Percocet, it also has a lot of Tylenol in it, acetaminophen, and acetaminophen can affect the liver as well. So you want to talk to your prescriber about this and see. And there are treatments and workups for fatty liver. And the main treatment is getting your insulin levels down, getting your glucose levels under control, so you need testing for all of that, and getting you off medications that can irritate your liver further, which could be things like acetaminophen, okay? So get to your primary. If they're not comfortable with it, they can send you to a gastroenterologist that deals with liver disease called a hepatologist, but all gastroenterologists are, at least partially hepatologists. Some only do hepatology, but most of them just like doing scopes. But they can deal with liver issues as well. Okay, so get that taken care of. Let us know how it's going. Okay. All right. Let's see what else we got. Yeah, McRibs. If I were to call in, would I have to wait 7 years to get my question read? No. Yes, it would be on the next show. We are actually have run out of new questions, and it's just because we haven't been on. People haven't been calling in. So call in 347-766-4323. We will get your question on unless it's just grossly inappropriate, in which case I'll send you a text saying, I'm not playing this shit. But other than that, yes, absolutely. No, yeah, McRibs, I know you're being a smart ass. It's fine. Oedipusasaurus Rex says, my friend was horribly addicted to kratom, having horrible bowel movements. Yeah, it causes constipation just like Percocet or anything else. And he says, yes, you're getting medicine that's being measured. You have group therapy. There's so much fentanyl out right now. Yes, fentanyl is the real problem right now and when it comes to street drugs. Looks like next week we have a call from the lovely and delightful Chad Zumach, and we've got some calls coming in. Thank you all for sending in phone calls. So that's a teaser for next time. All right. Until next time, check your stupid nuts for lumps. Quit smoking. Get off your asses. Get some exercise. We'll see you in 1 week, hopefully, probably 10 days, for the next edition of Weird Medicine. Thanks, Dr. Scott. Thanks, everybody.